their thinking. And what that has really meant is, are we still teaching people to think? I like to say that real learning really happens, means that thinking and problem solving until your brain hurts. Yeah, you really feel your brain hurt. And that productive struggle is where learning sits. Um, and that is becoming increasingly difficult to cultivate when every answer is just a single prompt away. Um, so then the next challenge is the pace of technology itself. The last 2 years have, frankly, as an educator, been perplexing because innovation's moving fast, and as educators, we're asking ourselves some hard questions. What value do we bring? How do we need to change what we teach and how we test it? And the tools that we use to test critical thinking are really falling short. Um, if those of us who are training the future workforce at well-resourced institutions like Johns Hopkins are struggling to keep up, I imagine what it looks like for a healthcare worker in an underserved district who has never actually received any structural digital education. And so the gap between the pace of innovation and the readiness of our workforce is where what this panel is aiming to address today. Our panelists will examine 6 interconnected dimensions of this challenge. Organizational actors, who must be at the table? We know the Ministry of Health is an actor, but there are education universities, there are professional associations, there are software vendors, there are technology associations, engineering universities, and so on. There's also diverse types of personnel that need to be reached, healthcare professionals, but also technologists, informaticians, and so on, engineers. The modalities through which we can deliver training, because we need to think about pre-service training when we think about the long-term future, and then we need to think about the now, which is in-service training to rapidly get our workforce ready. There are significant equity considerations which often get overlooked, especially when we think about technology. Gender gets overlooked quite seriously. And then there are some other barriers, cultural barriers, structural barriers, resource barriers. So what we are here to ask today is, what does it really take to build a workforce that is ready? Not just the tools that are available today, but imagining the pace for what is coming in the future, in the next 5, 10 years. What do we need to build now to be ready for that? And so with that, I am delighted to have this wonderful panel. I'll hold off on introducing the panel till we can have Dr. Sachin Sharma offer opening remarks. He's the Director General of Upskilling. So please, Dr. Sharma, welcome.
First of all, thank you very much for inviting me. And okay, 2 or 3 points. See, I'm not expert in the health. I'm a trade person. But why the Dakshin or the RIS, we are involved in it. Dakshin, where the RIS, Dakshin is a center within RIS, and it is a voice of Global South. And it was opened in 2023, and there we are working on agriculture, digital, and health is a very important issue. And we are not working only in India. We have a very good network of think tanks. If I say it, around 157 think tank across 90 countries. So that is the vast network we are working on this. Now, when we are talking about the AI and the health challenges in most of the developing country, in the global south, you will see the lot of variations, especially about the challenges the different countries are facing in health sector. So you will face that in the some countries, even the basic digital divide is there. That we are talking about AI, that's a digital divide. One is the point we are talking about. Then the second factor is that whether the basic health services is also available or not. Here the primary health workers' role is extremely important, and there we need even the yesterday our PM also said that what we required skilling and reskilling, and this is applicable not only for other sphere but also the health workers as well who are in the frontier. So In this case, because I also wanted to learn, I will not take much time because already it's a bit delay. But I would also looking forward for very insightful discussion. Thank you very much.
Great. Thank you, Dr. Sharma. And so let's maybe get started with our panel. We have an excellent panel here today. I'm not going in the order of where the panelists are seated, but Dr. Anurag Agarwal, he is the Dean, Biosciences and Health Research at Ashoka University. We have Dr. Mona Duggal, who's the Director of ICMR, National Institute for Research in Digital Health and Data Sciences. Like my center, this center has a long name. Dr. Mona Kocher, who's health advisor to Dakshin, RIS. Dr. Ranjana Kumar, who's the Chief Executive Officer for Chakra, Nasik MUHS. Dr. Thitipol, Director of Regional Center for Human Rights in Thailand. And Professor Fuad, who's Education and Cultural Attaché, Embassy of Republic of Indonesia. So with that, maybe I will start with Dr. Anurag Agarwal. My question to you is that the Koita Center for Digital Health, it works on interdisciplinary collaborations. And of course, in AI, that is absolutely critical as you consider data science, but you also think about biomedical sciences and its application to health. What, from your perspective, are some of the skills that educational institutes need to develop?
Thank you very much, Smisha. And as you indicated earlier, AI has really changed the game quite a bit. Classical skills that were more about information retention and production will increasingly become less relevant, and ability to use AI will become increasingly more relevant. At the same time, from an educational institution point of view, you can't dilute critical thinking and knowledge, especially in mission critical applications like health, where if AI were to fail, would you still be able to do the task? So very broadly dividing, as a general policy in training of students at large, one must ensure they can do critical tasks without any digital health available to them, but they're empowered to use it in such a way to be the most productive version there are. And this involves complete rethinking of the education evaluation system. You must go down to very basic systems from time to time when you cut off all digital access while evaluating them. But also you must almost encourage. So we do that at Ashoka. So Gemini, for example, as part of our workspace, is encouraged to be used, including in homework. But the questions to be set are thought of in such a way that you are allowed to push yourself to the boundary. Now, coming to the larger problem of health, and I'll be brief on this, health of the future will not look like health of today, with increasing emphasis on health promotion, maintenance, wellness, things like this. People far beyond the medical space will become engaged in the process of health sciences. In fact, I would argue that health will move out of medical schools. And public health at one part was never classically medical to begin with. And we'll see a generation of people engaged in quantitative thinking, data science, who will be contributing to the health ecosystem. And we're not ready for that. In India, at least, our medical colleges, our engineering colleges, our universities are all completely dissociated. And we will need to think of ecosystems where all this comes together. Rather than medical colleges opening departments of health informatics, that will not be sufficient. It'll be about rethinking what you do in the age of AI. And I would actually argue that as time goes forward, understanding of problems and engineering mindset, but not an engineer, an engineering mindset that breaks down the problem into solvable parts and uses AI to think about it will become increasingly important. I don't think we are getting there yet. We want to produce more AI engineers. What we need to produce are more domain knowledge people with wide grounding who think like engineers in breaking down a problem. I think that's what we need to do.
Yeah, and I think that's a tall task, right? Because the incentives to think are actually much slimmer now. And yeah, some excellent points. Dr. Mona, maybe I'll move on to you. And of course, as you're a medical doctor, what are skills that you think are critical for medical and paramedical professionals that the education system, the medical education system, doesn't yet address, but is really critical for the future workforce?
Thanks, Anisha. I will take it where Anurag left. Two things when we are talking about medical, and I think increasingly it has been getting highlighted. The medical professionals really need to upskill themselves at this point. And given when you simply just look at the level when we are at the top and the people who are running the any medtech industry, there's a huge generation gap. We generally like go slowly, and the people who sit at the top, it comes with experience. It's not that a youngster is going to be put on the top immediately. It requires experience. So people who are at the top are generally more experienced, less technology savvy, as compared to the new generation that is going on. But given the new ecosystem, I think with AI and everything, everybody has to now upskill themselves. But probably it has to now start from the medical schools and the allied schools. So you will have to rethink how you want to structure your medical curriculum. Earlier, it became almost done deal that now you have to get statistics. People need to learn statistics. At least that became a part of the curriculum. Um, what we have realized is when even you're doing the MD or the MS courses, if that can become a part of it, how do you think about research? What are the essentials of research? How you can use AI in research? How the digital tools can be applied in research? How you share the data? Simple things as that. What are the EHRs and everything? That should be a part of the curriculum that has to be there. At least when you're doing your MD thesis, that is a minimum that you can do for anything. We have a lot of people that do come, like coming from PGI. I know that we have a lot of people who come from the state systems also. Maybe again, redesign people who are coming from the state systems. They also need to have, like, even if they do not want to do thesis, probably they can do some projects, pilot projects with states. And if they can actually turn that state project into learning some of the digital tools, just having how the EHRs are going to be there, what are the system changes that they can do using AI or any of the digital tools. These are some of the changes that can be done. At the national level, where I am, like from the national level, being a research institute, we need to upskill our program managers. Because even the program managers who are reviewing the grants, I think because I'm on those NSF emails, they continuously do the surveys how they can upskill their program managers. So that really needs to be done because people who are reviewing also need to update their skills for review so that they can understand what people are submitting. Because with increasing cross collaboration, we have brilliant collaborations that are now being put. But the unfortunate part is when you actually talk to them, they said, we do not understand why a grant was rejected. And the kind of comments you get back, that needs to be upskilled. So these things, I think, both at the level of the input and the output, both needs to be balanced.
And I think your last point is really pertinent as well. I serve as the chief editor of Oxford Open Digital Health Journal, and in the last 6 months, we've seen this massive increase in AI-based methodology. But it is impossible to find reviewers who can skillfully actually review those papers and provide sound peer review, which I think is also quite dangerous when we think about the nature of knowledge, right? Because a lot of the AI models are being built on this published material. But as an editor, it's pretty hard to feel confident in what you're publishing. And so, I think your point about like making sure that people who are reviewers, who are playing that role of peers and providing guidance on research, also have critical skills of at least being informed consumers for learning. I feel like you have a point you want to add here. Okay. Okay. Yeah. Great. Okay. So, Professor Fuad, I'll come to you. You work at the intersection of education, culture, and governance. And what governance approach is needed to coordinate across ministries and countries for digital health and AI? And
All right. Thank you very much, Misha. First of all, thank you very much for inviting me. As Misha just mentioned earlier, my name is Fuad. I work at the embassy, but before that, I work at the professor in the Minister of Higher Education in Indonesia. But then the minister asked me to work on the bilateral cooperation between Indonesia and India on terms of the education, science, and technology. And I'm very fortunate to be able to, be here. And before I come up with this issue, I just would like you to give a brief context of Indonesia, particularly for those who are not very familiar with Indonesia. Indonesia is located in Southeast Asia. It is the fourth most populous countries in the world, and it comprises of more than 17,000 islands, and it has one of the largest health insurance systems in the world. It is a bit different with the India, but on terms of how the insurance system is governed nationally, and on terms of the population covered, yes, it is the largest. And answering on terms of the coordination and what are the obstacles and the opportunities, and what we are currently doing is that we have one national direction, particularly on terms of the health-related issues. Because when we talk about the health outcomes, it means that the outcomes of the health is heavily influenced by the decisions made by other ministries. For instance, the Minister of Health focuses on how the clinical procedures and the patient safety are the main concern of the Minister of Health. But for the Minister of Higher Education, Science and Technology, focuses on how the capacity building, on how the doctors, the nurses can be well equipped and can be well, taught on terms of the health and also the technological issues needed for those doctors and nurses. And similarly with other ministries as well, the Minister of Finance, the Minister of, let's say, the digital and communication are also the important parts of when we talk about how the coordination between the health-related issues. And so, yes, we have to have one clear central direction on, determined by the, by the central government. Yes, and secondly, we have to realize that AI is actually just a platform on which we have to make sure that the people and trust is actually the integral part or the most important part of the whole ecosystems. Because without any trust, without having to make sure that the platform is actually just to make sure that the people, the doctors, the nurses can work much more efficiently, much more effectively, so there is no need for this. And it's just like, so the main thing that I would like to point out is that having the new platform or having the new AI doesn't necessarily mean that it has to create more burden towards the doctors or towards the nurses. So it's just like teaching someone to swim while they are already drowning. So it means that we have to realize that they have overloaded with the works, with the responsibilities, and so forth. So, and last but not least, I think related to Misa's question is how to make the seamless collaboration between countries, particularly because I work in Embassy of Indonesia, so it means that between Indonesia and India. So what I'm trying to say is that it doesn't have to be, we have to make uniform systems, uniform platforms. No, it doesn't necessarily have to be that way, but it just simply means that seamless collaboration, how that we can share, AI works much better if we have a lot of training data at hand, right? So I think it would be better if we can start the way we have to think about it again, the seamless collaboration, I think, is the most pivotal point on this matter. Thank you, Misha.
Great, thank you. And I think your what you said about teaching people to swim while they're already drowning is a great analogy, because of course these tools are overwhelming for providers. And I think in other countries where providers are being taught to use electronic health records, while they're providing care. The research shows that it really interferes with their quality of care, their perceived quality of care, at least, right? Because they're used to seeing the patient. Now there's a screen between them and the patient. There isn't eye contact. There isn't the human touch feel, and so on. So I think that's a very good analogy. Thank you. Let's move on to Dr. Titipol. What are some of the training approaches when introducing digital and AI tools in primary healthcare contexts, in the context of Thailand?
Uh, yeah, perhaps I would want to mention this first. When you look at the system in Thailand, we have the universal healthcare coverage, or it's called other names called 30 baht healthcare scheme, or the gold card, that actually provide access to healthcare for people like almost 2 decades ago. But it doesn't mean that everyone have proper access to healthcare services in the country, especially people in rural villages. And now but in addition to this, we also have the so-called village health volunteer that are working with the, all local health authorities. And when we look at the roles of this group, they have played quite significant roles in providing and assisting local villages to have the primary cares, and they are not digitally naive. And they in Thailand we also have the so-called, I think I'm not sure if you are familiar with Line application, and it's similar to WhatsApp that you are using here. So this is one of the main mechanisms that people will let health volunteers use. And I think it is important to use the CAP AI and to play the roles in this regard, and how the government actually scrutinize and actually digest information, because as we mentioned about the information, from medical journals and this kind of thing. So I think it is very important that if the Ministry of Healthcare in Thailand can actually help to digest information, and how can we actually pass through this information to this kind of application. And the other platform that we have is called Doctor at Home. And one of the main questions that I have is, now in Thailand we have a problem, I think similar to other places in the world, that about the circulation of information, and many internet influencers in the country has been using this to mobilize their followers and circulate all kinds of health recommendations, and that is one of the main challenges. So how can we actually control this and ensure that like for example, the case of village health volunteers, that they can get a proper reliable information. And this is very important because they are the very first person who connect with villages and provide primary cares, and their roles is also to mitigate the negative consequences of the false information in villages as well. So in this regard, it's a big question: how can actually AI help to digest and scrutinize information for these groups of workers in the front lines in Thai villages?
That's great, thank you. And you introduced the terms digital naive and digital native, and I think that's a really important perspective. Of course, because digital native population, generally a younger population, they know how to use phones. They know the basics of device maintenance, right? Like basic of any device maintenance. They're the digital native population. But the digital naive population in most countries, they know how to use a particular app, right? They don't know how to maintain the device that the app sits on. And often that is the fracture point in practice. And that's the piece that gets missed out. So if you look at health workers, where you've introduced this incredible app that's been spent with multi-million dollars of investment, with the perfect data, with perfect user interface, it cracks not because of the content of the app, but because somebody hasn't figured out how to do virus updates, or or just like basic maintenance of can't find the pictures, can't find the windows, can't remember their password, has been locked out of their system, and so on. And I think that's the basic digital literacy that eventually helps breakdown of the system. So thank you. Maybe Dr. Ranjana, I'll move on to you. In your current role as Chakra, you're tasked with building centers of excellence to strengthen education, digital education, but also previously in your role with Gavi, you have worked across the world on a variety of digital programs. What are some of the gaps you've seen, and how is Chakra addressing some of these gaps in your current role?
Thank you very much. Before I start on that, on Gavi and Chakra, I just wanted to comment that you mentioned about people don't know remember their password, they don't know the app, they forget this. That sounded like me. So coming back to digital, I was with Gavi, the Global Alliance for Vaccines and Immunization in Geneva for almost 18 to 20 years, and I recently retired and came back to the country, and now only for 6 months I've been CEO of Chakra. So a little bit on Chakra is that the government of Maharashtra is setting up so many medical schools and colleges, almost one in every district, and we found that there is faculties lacking. Let's talk about AI, which is another step, but main core faculty is lacking. So what Chakra aspires to do is promote educational excellence, also advance research, because the R part research was missing, and which will thereby improve patient care. And this is a tall order and agenda, but we are also harnessing the youth and the energy and the brilliance that the youth bring to that. So we have a lot of engagement, and we offer a lot of courses on faculty development, digital health, and AI are a couple of modules there. We also do a lot of provide opportunities for health technology, and also, of course, research. Particularly on digital health and AI, there are a couple of courses that, along with the Maharashtra University of Health Sciences, we are offering to, the minimum this thing is they have to be undergraduates. So it's more for postgraduates and all other allied health services, because the MUHS or Maharashtra University has more than 500 affiliated colleges. And what we have seen is that in this age, unless you embrace technology, embrace the new tools which are coming, you will be completely overwhelmed. So it's really readying a workforce who's learned practice probably like us in 20th century to practice in the 21st century with all these tools. That's the agenda. And through this Chakra, what we are doing is that we are offering a digital health foundation course. And this is basically, you have to be an undergraduate. This is entirely an online course. And it's also published on it's all open source with all AI and digital health modules. Thousands of children, thousands of students have enrolled for it. It's also published on iGot platform. It's their open source in our ePrabodhini platform of the university. We also have a digital health foundation course for nursing, so that they are also responsible and aware of the tools which are out there. And there is this thing we tested, which is digital course on health. And that is really a 6-month certificate course where students do capstone project, which you told me in the break that it's out of league already, it's out of fashion. But they choose the projects, and I saw that some of the health initiatives like the Ayushman Bharat, the digital health mission, which they try to, and they're trying to see how can some of these government subsidies and these schemes which are available, how can students really avail of it, and also the faculty, so that much more primary healthcare workers are involved in that awareness and they can avail of these services for greater good. Just because you mentioned Gavi, Gavi works in more than 50, 60 countries now all over the world. And we had already included in our grants, and I used to look after the health systems portfolio at that time, which is strengthening health systems in the country. And already digitization in primary health care was one of our tenets which we used to do. And it's not only electronic health records, we used to call it electronic immunization registries. But what we saw that if you look at immunization dropouts, we want 100% immunization in all countries and in children. But there we found out if there was electronic health records, then the WHO standard of 5 to 7 dropouts, you are able to reach those children who are already enrolled. And that the primary healthcare workers could do. But that will not help us to reach universal health coverage, which was then again with Government of India, we worked a lot on, we started with the EWIN platform, the UWIN platform, now there was a CoWIN platform. So they have another platform is the maternal and child health programs. So how are all the vital registrations happening there? And they're all by primary healthcare workers who do it. And there has to be an interoperability of these platforms so that really we reach out for universal healthcare. And then, and the primary healthcare workers have a really key role in that. Thank you.
Thank you very much. And thank you for the broader perspective as well. Maybe just for the audience, the comment on capstone projects were, of course, capstones historically have been a medium through which learners can, you remember back in the days we used to go to libraries, physical libraries. So, you'd go to the library, maybe look up some books, maybe online libraries. But now, of course, with the deep research, online deep research, you can suggest a pretty good prompt and get the most sophisticated capstone. So the quality of our capstones really went up in the last 2 years. I don't think the quality of thinking necessarily did. Associated with that. It was supposed to be the grand finale of most degrees. You spend 3 to 6 months on it. Now you can spend 3 to 6 minutes on a much superior product. So it's just something to think about. Okay, so finally, thank you, Dr. Monica Kochhar. You've been waiting. we have a good and insightful panel. But there are several areas where India has huge strengths. I think especially in the IT space, right? And there are, of course, lots also to learn from other countries and contexts, and that's part of your mandate with South-South collaboration. So how are you fostering these interlinkages as part of your role, and what are the areas of focus for you?
Thank you, Smisha. This is an important question, and South-South collaboration goes a long way. So when we talk about India's strengths, yes, we are at the helm of it with CoWIN, ABDM, UWIN, EWIN, and very recently launched AI guidance platform in health care. I think we are there, raring to go ahead. But then, is it just about us, or is it taking everybody along? And that is the theme of the summit as well. Happiness for all, welfare for all. And that is somewhere where Dakshin comes in. Dakshin, a platform which was launched by the Honorable Prime Minister after the G20 presidency of India, wherein after the Voice of Global South Summit, there was a realization that most of the Global South countries are struggling with similar challenges. They are all working in very, very resource-limited settings. And it is about time that we stop reinventing the wheel all over the Global South countries and institutionalize the cooperation between the Global South countries. And that is how Dakshin came into being. Now, how do we work at Dakshin? So Dakshin convenes a structural exchange of ideas, a structural exchange of best practices. It is not just about India, it is about what we learn from others and how others learn from us. Learning the best practices, the challenges, the limitations of all the Global South countries together. So we bring in the think tanks, the educational institutes, researchers, and the technical partners as well on one single platform, feeding into the research work, the, the policies which are later on framed by the government and which are evidence-based. We've been talking about evidence-based policies from quite some time. Now it's about time to work on it. And that is what Dakshin is doing. We are enabling the Global South countries through our think tank partners to analyze their gaps, the gaps in their structure, in their systems, and how to strengthen them in the due course of time. So it is not just about technology, it is also about system strengthening. It is not project-based. It is about strengthening the complete ecosystem, which includes the primary health systems as well, you know. So that is how the Dakshin works in. And that is how the collaborators and the think tanks are brought together. Why think tanks? If you have this kind of a question in mind, think tanks because of their proximity with their respective governments. So G to G, yes, but then think tank to think tank, evidence-based policy framework, I think that is also important. And that is how Dakshin plays an important role in South-South collaboration. Thank you.
Thank you very much. Professor Anurag, I can tell that that you have many points to make, and I welcome them. I have many things to follow up with you on. So those points, and also I want to ask you one follow-up question to your earlier point. What is the one job that you think is going to disappear in the next few years? But you can answer that last. I'll give you time to answer that. Okay.
I'll give a general purpose answer to the last one come before I go. So is anybody who sits entirely on a keyboard to do their job is at risk of disappearing. And that could be any job where you sit only on a keyboard, because what you do on it can probably be mimicked by an AI. And that's, I'm borrowing from Elon Musk's views on that one. But let me come to one thing that I think went unsaid. When we thought about education for building a health workforce, we talked about problems of Global South and the challenges we face. But we never spoke about health entrepreneurs. People who build world-class products that the Global North will use. Until we change the mindset in our education and training of our workforce to at least develop one product that the Global North would use, we are anyway going to stay with all Global South problems forever. Wealth is one of the differences between the Global North and Global South. A Global South health strategy should not ignore the importance of creating solutions that generate wealth for the what is currently the Global South. And this kind of entrepreneurship education, aspiration, cutting edge training is as much part. And which is why when the health strategy Sahi was launched yesterday, we actually have innovation over regulation, right? As one of our points. Because we could go in many directions, but real innovation at the cutting edge. And for this, who's going to make it, right? Medical doctors can be service providers. They can be enabled by AI to become better service providers. There's no problem on that. But can people with an understanding of the problems of health be enabled in their educational curriculum? Perhaps not necessarily inside the medical college, perhaps by combinations like we are building with the digital courses, the Quetta Foundation is working with MUHS and many others, to look at what is not yet done and where our numbers can come into play. And we are seeing that happen in a variety of sectors, right? In fintech, etc. Why not health? Now coming to the job that is most at risk, I would actually say consultancy.
Okay, about time. About time. So many thoughts on entrepreneurship. Our program, we have about maybe 60 Indian students every year, and they all have startup dreams. And I think one model that has worked very well, and we have that here too, is combining medical healthcare with technologists, but putting them in the same room, having startup ecosystem where they can communicate, talk to each other, identify problems. And so there's a lot of practice-based learning, but a lot of students come out of the program with startups, with a use case that is somewhat functional. So yeah, please, I turn over to you, Dr. Ranjana.
Thank you. You know, this question and what our Indonesian colleagues sort of said, it struck to me that we are entering into a world of a lot of interdependencies. And the interdependencies of technology with healthcare, which we are all concerned about, and we need to move that with times. And I'll give one example because I've been in Switzerland for so many years. You know, the Swiss medical school, in their, I think, 4th year or so before they go to final MBBS, they actually have a semester in the Technology Institute so that they learn the technology, the devices, what are, you know, the 21st century, and that's mandatory for them to be graduate out of medical school. And here in Chakra, what we saw was that we had partnership with Koita Foundation, with IIT Mumbai, because the courses on technology which were being offered, they actually are meant for healthcare workers. So for IIT Mumbai, then the technologists would take those courses and not the health professionals. So I think that kind of understanding the interdependencies and leveraging those to our benefit, to the benefit of the healthcare, is really important as we go along. Thank you.
And that's a great point, to understand interdependencies. You really need to have, I think, what people say soft skills. I like to think of them as power skills, right? They are not skills you can sit doing at a computer. And so if you think about the large technology firms, of course, the lower level coders, those jobs, if you're mediocre, that job can be automated. Right? If you're a more sophisticated coder, but if you're a manager, you're likely to keep your job because you need to work with people and machines. And that's, I think the same is true for healthcare, where all of these studies are saying that LLMs are much better than physicians at empathy. And, you know, how do we change that? We have this large clock ticking in front of me. And I want to just turn over to another rapid fire round to the panelists to say, talk about just the one sort of shift that you see that needs to happen in health workforce training in your context. And I'm giving you, maybe I'll start with Dr. Mona in the middle. Okay.
I wish we could just change the hierarchical system in the healthcare. Everybody is equal, everybody can talk to anybody without thinking. I think that is one thing, because we are the most hierarchical the system, I think. If we can change that, I think automatically everything will be at par.
And the digital naives might learn something.
Yeah.
So, okay. Dr. Titipal?
I think if we look at in the context of Thailand, decentralization of power is important because different regions have different healthcare concerns. So I think when we talk about the local workers in villages, then they should have more authority to decide what is actually or is best for them, or what should be educate people in villages. Because currently now everything is controlled by the Ministry of Health and in Thailand. So I think it's decentralization of information is important.
Thank you. And Dr. Ranjana?
I think one thing which really needs to, I agree with what Dr. Mona said. I 100% agree to that. But I think we need to do away with this fear complex. So I mean, question, because, you know, the human centeredness of healthcare will never go away. Anybody would like to have that human touch and a health professional than talking to a computer. So that will never go away. So one thing we really need to change is befriend the tools. Befriend the tools, use them to your advantage to go ahead in the 21st century. Thank you.
Thank you. Maybe I'll start here with you, Dr. Fuad.
All right, thank you. I just want to point out that at the end of the day, doctors are the ones that held responsible for the decisions they make. So it means that to make use or to rely 100% on the products of AI is actually, you know, too much. So that's my point. Thank you.
Yeah, and so accountability really is for Dr. Anurag.
Rise of liberal arts and critical thinking.
Yes. No conflict of interest. No. Dr. Monica.
I think trust in the digital systems by the health workforce would also be important. Ultimately, the systems are being prepared for the people to work on. And if they adopt the systems, that would really be helpful. Yeah. Having worked with the workforce at the front line, you know, I've realized that they are still skeptical to the use of these AI systems. And we need to earn their trust first. That's a
great summary. And with knowledge comes trust. And so I think with that, maybe can we have a round of applause, please, for this panel. Okay. Okay. Great, thank you. Okay. Thank you. Thank you very much for your question. Yeah, maybe. Yes, please.
No, I think all your points are very well taken. And when we train the health workforce, we shall make sure that these things about the limitations of the AI models are communicated. And the fact that all models are flawed, some are useful, is made more obvious. Thank you.
Thank you. I think, yeah, let's take the... Okay.
This is also required from all the people who can say that this healthcare people who are working with doctors and layer of the creamy layers of the doctors.
Great. Thank you very much for your, thank you very much. Thank you.